Hello, my name is Colleen Sturnell, and I am a pediatric dietitian at OHSU in the Dornbecker GI Specialty Clinic, as well as the Child Development and Rehabilitation Center. Today we're going to talk about the low FODMAP diet. What is the FODMAP diet? Well, the term FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. This diet contains foods that are low in short-chain carbohydrates and sugar alcohols. These type of carbohydrates tend to cause gas, bloating, abdominal pain, and diarrhea by means of fermentation in the colon. As this chart indicates, there are 5 categories of high FODMAP foods. These categories are lactose, fructans, polyols, galacto-oligosaccharides, otherwise known as GOS, and fructose. Lactose is the sugar found in milk and other dairy products. Foods vary widely in lactose content, and therefore some lactose-containing foods are allowed on this diet, but in limited quantities. Fructans are primarily found in wheat, some vegetables, most notably garlic and onions, and the food additives fructo-oligosaccharides and inulin. Fructans are non-digestible and therefore can be acted upon by the gut bacteria via fermentation. This process often results in some health benefits, but can contribute to unwanted symptoms of gas and bloating in people who have IBS. Polyols and sugar alcohols, with the names typically ending in "-al", are found naturally occurring in fruits and some vegetables. Blackberries, cauliflower, and mushrooms are some of them. And they're often used as artificial sweeteners. GOS, which is also referred to as galactans, are non-digestible like fructans and have a similar effect on the body, whether or not a person has IBS. GOS can be found in legumes, including beans, chickpeas, and lentils. It is possible to have some chickpeas and lentils on the low FODMAP diet, but this is another category where small quantities would be warranted. Finally, fructose is the sugar naturally found in many fruits and in honey, and is also found in high fructose corn syrup. Now that we know what is not acceptable on the low FODMAP diet, some examples of foods that are compliant with this are seen in this chart. Any lactose-free dairy products, which include hard cheeses, butter, and lactose-free milks, in addition to the non-dairy milk alternatives, are acceptable. There's also a variety of fruits and vegetables included in this diet, such as carrots, broccoli, most berries, and clementines. Within the grains category, rice, oats, cornbread, sourdough, and quinoa are acceptable. Proteins in themselves are naturally low FODMAP, and we're not really concerned about that. What we are concerned about the proteins are the added sauces and gravies, as most often they have non-compliant items in them, most notably onion and garlic. Finally, most nuts and seeds are compliant with this meal plan, with the exception of cashews and pistachios. Now that we know what the FODMAP diet is, what type of people would benefit from following it? Well, as I alluded to earlier, people with irritable bowel syndrome, or IBS, definitely do, as well as people who have fructose malabsorption, as they have been shown to benefit the most from the low FODMAP diet. There has been multiple randomized controlled trials that have indicated a 50 to 80% positive clinical response in the patients with IBS when following the low FODMAP diet. Diet implementation should include a referral to a registered dietitian who specializes in GI disorders, as this is the preferred method of implementation. The patients are instructed to follow the diet for 6 to 9 weeks, after which a challenge or reintroduction phase is implemented, and then finally a maintenance phase. During the challenge reintroduction phase, foods are typically recommended to be introduced on a rolling 6-day schedule with 3 days of the challenge and 3 days of the washout. In clinical practice, I have them do the challenge phase in weeks, as this is a more practical implementation. The structured reintroduction of foods help to determine sensitivities and allow for personalization of the diet plan, as the low FODMAP diet is not meant to be a permanent solution due to the restrictive nature. As with any restrictive diets, there is a word of caution in recommending this diet. New recommendations are to pre-screen for any eating-related disorders prior to a diet initiation, as there has been an increase in these type of disorders with restrictive diets. In addition, again, with any food restrictive therapies, there is always a risk for nutrient deficiencies, which need to be addressed prior to the diet initiation. Again, I can not stress this enough, referral to a dietitian who is well versed in the low FODMAP diet is warranted. In addition to screening for eating disorders, they will be able to tailor the diet to the individual, help with nutrient deficiencies, and break through barriers that the patient and families may be facing, such as financial constraints, anxiety, skill level in the kitchen, and education level. Thank you for your time. Again, if you have any questions, comments, or concerns, feel free to reach me at sternell@ohsu.edu.